If you or someone you love has been living with diabetes or struggling with rising blood sugar levels, you may have wondered whether there is something simple, something natural, that your body might be missing. Over the past 23 years of caring for adults in their 60s, 70s, and beyond, I've had countless patients sit across from me and ask a very similar question. They often say, "Doctor, I'm doing my best. I'm eating carefully. I'm trying to stay active, but my blood sugar still isn't where I want it to be. Is there something else going on inside my body?" And that is a very thoughtful and important question. As we grow older, our bodies change in quiet and gradual ways. These changes are not failures. They are part of the natural aging process, but they do affect how efficiently our bodies manage sugar. The cells may not respond to insulin as easily as they once did. The pancreas may not release insulin as smoothly. Muscles may use glucose less efficiently. And even when you feel like you are doing everything right, your numbers may slowly begin to shift. This can feel frustrating, confusing, and sometimes discouraging. What many people don't realize is that blood sugar regulation is not controlled by insulin alone. Insulin is only one part of a much larger and more delicate system. Your body relies on a network of signals, nutrients, and cellular processes that must work together in balance. Among these, certain minerals play a surprisingly important role. These minerals do not replace insulin. They do not act as medications, but they help the body use insulin more effectively, and that becomes especially important after the age of 60. I want to be very clear about something. When we talk about minerals and natural support for blood sugar control, this is not about quick fixes or miracle claims. In medicine, we rely on science, evidence, and decades of observation. And over the years, researchers and physicians have learned that some essential minerals are deeply involved in how the body processes glucose. In fact, deficiencies in certain minerals have been associated with reduced insulin sensitivity, meaning the body has to work harder to achieve the same results. This matters even more as we age, because older adults are more likely to experience subtle nutritional deficiencies without realizing it. Appetite may change. Digestive absorption may become less efficient. Dietary patterns may shift. And the body's ability to retain and utilize certain nutrients may gradually decline. These changes are often invisible. You cannot feel them directly. But they can influence your metabolic health in meaningful ways. I have seen this firsthand in many of my patients. Individuals who were careful, responsible, and committed to their health, yet their blood sugar remained unpredictable. They often blamed themselves. They wondered if they had done something wrong. But in many cases, the explanation was not about effort or discipline. It was about understanding how aging affects the body at the cellular level. There is also a common misunderstanding that diabetes is only about sugar intake. While diet certainly plays a role, diabetes is fundamentally about how the body handles sugar, not just how much sugar is consumed. It is about communication between cells. It is about sensitivity to insulin. It is about metabolic efficiency. And minerals are part of that communication system. I understand that some people feel skeptical when they hear discussions about minerals and natural support. That skepticism is healthy. It shows that you care about evidence and truth. My role as a physician is not to offer exaggerated promises, but to provide clear, honest education based on science and clinical experience. My goal is to help you understand what is happening inside your body so that you feel informed rather than confused and empowered rather than discouraged. After the age of 60, maintaining stable blood sugar becomes more than just a number on a lab report. It affects your energy, your mental clarity, your circulation, your nerve health, and your overall quality of life. Even small improvements in how the body manages glucose can make a meaningful difference in how you feel day to day. And understanding the role of key minerals is one important piece of that larger picture. This is not about replacing medical care. It is about understanding your body more deeply. It is about recognizing that your metabolism is influenced by many interconnected factors, including nutrients that your body depends on every single day. When you understand these relationships, you begin to see diabetes not as a personal failure, but as a complex medical condition that can be influenced by physiology, aging, and nutritional balance. and that is why today we are going to explore one specific mineral that has been closely linked to blood sugar regulation, especially in older adults, and why its role becomes more important as the body ages. To understand why this mineral matters, it helps to first understand how your body normally controls blood sugar. Every time you eat, especially foods that contain carbohydrates like bread, rice, fruit, or potatoes, your digestive system breaks those foods down into glucose, which is a form of sugar. That glucose enters your bloodstream and becomes a source of energy for your cells. But glucose cannot enter the cells on its own. It needs help from insulin, a hormone that acts very much like a key. You can think of your cells as tiny rooms with locked doors, and insulin is the key that unlocks those doors. When insulin attaches to a cell, it sends a signal that allows glucose to move from the bloodstream into the cell, where it can be used as fuel. This process keeps blood sugar levels balanced and ensures your body has the energy it needs. Now, here is where this essential mineral becomes important. This mineral acts like a helper that makes insulin work more efficiently. Without enough of this mineral, insulin may still be present, but it does not function as smoothly. Imagine trying to use a key in a lock that is slightly rusty. The key is still there, but it does not turn as easily. This makes it harder for glucose to enter the cells, and as a result, more glucose remains in the bloodstream. One of the key physiological roles of this mineral is supporting what we call insulin sensitivity. Insulin sensitivity simply means how responsive your cells are to insulin. When insulin sensitivity is good, your cells respond quickly and efficiently. When insulin sensitivity is reduced, your cells become slower to respond. This mineral helps maintain the proper structure and function of insulin receptors, which are the small docking points on the surface of each cell. These receptors recognize insulin and allow it to deliver its message. Without enough of this mineral, these receptors do not respond as effectively, and communication between insulin and the cell becomes weaker. A second important mechanism involves cellular signaling. Inside each cell, there is a complex communication network that tells the cell when to open its doors to glucose. This mineral plays a role in activating enzymes, which are tiny proteins that help carry out chemical reactions. These enzymes help transmit insulin's signal from the surface of the cell to the interior, ensuring glucose transport systems are activated. You can think of this like a chain of messengers passing along an important instruction. If the mineral is lacking, the signal becomes weaker and glucose transport becomes less efficient. A third important function of this mineral relates to inflammation and oxidative stress. Oxidative stress refers to a type of wear and tear that occurs in cells over time, especially as we age. This stress can interfere with insulin's effectiveness. The mineral helps stabilize cellular environments and reduces some of this internal stress, allowing insulin to function more smoothly. It acts almost like a protective stabilizer, helping maintain the proper conditions for metabolic processes. Now, after the age of 60, several natural changes occur that make the role of this mineral even more important. First, the body's ability to absorb certain nutrients from food becomes less efficient. The digestive system may not extract minerals as effectively as it once did. Second, the kidneys, which help regulate mineral balance, may gradually change in how they conserve or excrete minerals. Third, muscle mass tends to decrease with age, and muscles are one of the primary places where glucose is used. When muscle activity and mass decline, glucose handling becomes less efficient overall. In addition, insulin receptors themselves may become less responsive over time. This is not due to anything you did wrong. It is simply part of aging biology. When insulin receptors become less responsive, the body must rely more heavily on supportive factors, including essential minerals, to maintain proper communication. Another way to think about this is to imagine your metabolic system as a large orchestra. Insulin is one of the main instruments, but it cannot perform alone. The mineral acts like a tuning mechanism that ensures the instrument plays clearly and in harmony. Without proper tuning, even a skilled musician cannot produce the best sound. Similarly, without adequate levels of this mineral, insulin cannot perform at its highest efficiency. This mineral also influences how glucose is stored and used inside the cell. When glucose enters a cell, it can be used immediately for energy or stored for later use. The mineral helps regulate enzymes involved in this storage process, ensuring that glucose is handled in a balanced and stable way. This contributes to smoother blood sugar control over time, rather than sudden spikes or prolonged elevations. All of these mechanisms, supporting insulin receptors, enhancing cellular signaling, protecting cellular stability, and improving glucose handling, work together to maintain metabolic balance. As the body ages, these systems naturally become more sensitive to changes, and the presence of essential minerals becomes increasingly important for maintaining efficient and stable blood sugar regulation. I remember a patient named Margaret, who was 68 when she first came to see me. She had been living with type 2 diabetes for nearly 10 years, and she was someone who took her health very seriously. She kept a small notebook in her purse where she carefully wrote down her blood sugar readings each morning. She watched what she ate, she stayed active by walking around her neighborhood most days. And yet, despite her consistent effort, her numbers had slowly begun to rise over the past 2 years. She told me something that stayed with me. She said, "I don't understand what I'm doing wrong. I'm trying harder now than I ever have before, but my body feels like it's not cooperating." There was frustration in her voice, but also quiet discouragement. She wasn't looking for a miracle. She simply wanted to understand why her body was behaving differently than it used to. Margaret also described changes that didn't always show up on lab reports. She said she felt more tired in the afternoons, even on days when she slept well. She noticed that after meals, she sometimes felt sluggish or mentally foggy. These were subtle symptoms, easy to dismiss, but they reflected the internal changes we discussed earlier. Her body was still producing insulin, but her cells were not responding to it as efficiently as before. The communication between insulin and her cells had become less effective, much like a key that no longer turned smoothly in a lock. When we talked about the role of essential minerals in supporting insulin sensitivity, she was surprised. She had always thought of diabetes as something controlled only by sugar and medications. She had never considered that the body's ability to respond to insulin could also be influenced by nutrient balance at the cellular level. Understanding this gave her something she had been missing, not false hope, but clarity. She realized that her experience was not a personal failure, it was a reflection of how the aging body changes over time. Another patient, Robert, who was 74, shared a very different but equally meaningful experience. Robert had always been active. He spent years working with his hands, and even in retirement, he stayed busy with small projects around his home. But over time, he began noticing that his energy was not as steady as it once was. He told me that some mornings he felt fine, but by midday, he would experience sudden fatigue that seemed out of proportion to his activity. His blood sugar levels were not dangerously high, but they were less stable than they had been in the past. He described feeling confused about why this was happening, especially since his daily habits had not changed significantly. He said, "It feels like my body is reacting differently to the same things." This is a very important observation, and it reflects one of the core realities of aging metabolism. The body you have at 74 is not the same as the body you had at 54. The systems are still working, but they are more sensitive to internal imbalances. Minerals that support insulin signaling may no longer be present in optimal amounts. Cells may not respond as efficiently, and as a result, blood sugar regulation becomes less predictable. What both Margaret and Robert shared was a sense of uncertainty. They were not ignoring their health. They were engaged, responsible, and attentive. But they were encountering biological changes that were not visible from the outside. When they began to understand that insulin's effectiveness depends not only on its presence, but also on the environment inside the body, their experience started to make more sense. They realized that blood sugar control is not simply about willpower or discipline. It is about physiology. It is about how well the body's systems communicate. It is about whether the cellular locks are still responsive to the insulin keys. And minerals play a quiet but important role in maintaining that responsiveness. What I want you to understand from these experiences is that you are not alone if you have noticed changes like this. Many adults in their 60s and 70s experience similar shifts. These changes can feel confusing, especially when you are doing your best to care for your health. But these experiences reflect the natural complexity of the human body, especially as it ages. And perhaps most importantly, understanding the role of supportive factors like essential minerals can bring clarity. It helps explain why the body may respond differently over time. It replaces uncertainty with understanding, and it allows you to see your health not as something that is failing, but as something that is evolving and deserving of thoughtful attention. What I want you to take away from this discussion is a deeper awareness of how your body works and how small internal factors can influence something as important as blood sugar regulation. Many people focus only on sugar itself, but as we've discussed, the body's ability to manage sugar depends on a much broader internal environment. This includes insulin, cellular communication, muscle activity, and the presence of essential nutrients that help these systems function smoothly. In daily life, this often shows up in subtle ways. You may notice that your energy levels fluctuate more than they used to. You may feel steady in the morning but more tired after meals. You may notice that your blood sugar readings are less predictable, even when your routine has not changed. These experiences are not unusual after the age of 60. They reflect the natural evolution of your metabolism. Your body is still capable, still adaptable, but it may require more careful balance to maintain stability. One important misunderstanding I want to gently clarify is the idea that there is a single nutrient, mineral, or natural approach that can replace medical care. Essential minerals support the body, but they do not replace the role of prescribed treatments or professional medical guidance. They are part of the larger picture, not a substitute for it. Your medications, your medical evaluations, and your ongoing care remain extremely important components of protecting your long-term health. It is also important to recognize that every person's body is different. Two individuals of the same age can have very different metabolic needs. Factors such as kidney function, digestive health, muscle mass, and overall nutrition all influence how minerals are absorbed and used. This is why decisions about supplements, diet, or any changes related to blood sugar management should always be made with the guidance of a qualified healthcare professional who understands your individual medical history. I want to be especially clear about this point. If you are currently taking medication for diabetes or any other condition, those treatments were prescribed for a reason. You should never stop, reduce, or replace them on your own based on general information alone. Your physician considers many factors when recommending treatment, including your lab results, your overall health, and your personal risk factors. Any adjustments should always be made thoughtfully and safely in partnership with your healthcare provider. What you can do is remain observant and engaged with your health. Pay attention to how you feel throughout the day. Notice patterns in your energy, your concentration, and your sense of physical well-being. These observations are valuable. They help you and your physician understand how your body is responding over time. Health is not defined by a single number or a single moment. It is a continuous process of adaptation and balance. Aging does not mean losing control over your health. It means understanding your body more deeply and supporting it in thoughtful ways. The human body is remarkably resilient even in later decades of life. With awareness, proper medical care, and a clear understanding of how your metabolism works, you can continue to protect your well-being and maintain a good quality of life. I want you to know that needing additional support, asking questions, and seeking understanding are signs of strength, not weakness. Your health journey is unique, and it deserves patience, respect, and careful attention. When you understand the role that essential minerals and metabolic balance play, you gain a clearer picture of how your body functions and how to work with it, rather than against it. You are not alone in this process. Many adults your age are navigating the same changes, asking the same questions, and learning how to care for themselves in new ways. With proper medical guidance, thoughtful awareness, and compassion for your own body, it is absolutely possible to move forward with confidence. My role, after more than 2 decades of caring for patients in their 60s and 70s, has always been to help people understand their bodies, reduce uncertainty, and replace fear with knowledge. Your body is still capable of balance. It is still capable of adaptation. And with understanding and proper care, you can continue to support your health in a safe, steady, and meaningful way. I'm Dr. Linda Harrison, and I want you to know that your health, your questions, and your peace of mind truly matter.